going to ask everyone to remember to be mindful of your personal and protected health information, PHI. That we want you to be mindful about sharing anything that would share information about you or someone you care about or love who might be information you might not want to be made public. So thank you very much. And thank you, Aaron, for sharing the screen. We have 44 people. It is now 1:02 p.m. Again, this is the May 2023 meeting of the PDPPC. So I'm wondering, Aaron, if you could make the screen image bigger or just select that tab only to share. Okay, thank you. Housekeeping. So one thing that I've been thinking of saying in recent months is reminding people about the open forums. The open forums, there's 2 of them. They're 10 minutes each. And we are committed to hold both of those every month. And those are times for stakeholders, including staff, including vendors, to make announcements, to make requests, to see if they can make connections with other people in the group, again, in a way that does not violate confidentiality. If there is someone who wants to give me, for example, Tom Berry, permission to connect them with another stakeholder or allow them to connect with them, I can do that offline. But these are not times for back and forth discussions about topics or getting into new topics. And we do have a topic request form for people to fill out that is online. And we realize that a few of our stakeholders are not online, in which case I want to invite everyone to call me on my desk phone, and I will put it in the chat, and I will give it right now. My desk phone, as always, is 303-866-3173. I'll put that in the chat in a minute. 303-866-3173. And that is for many purposes, one of which is for people who are on the phone only. If they want to make an agenda topic request, they can call and we can arrange that. Otherwise, we do have the topic request form. Thank you, Emily, for putting that in. And again, would just remind people that these are really important issues. This meeting has been going for 10, 11, almost 12 years now, and for very good reasons, which is that this is very important, these benefits, these programs, IHSS and CDASS, and feelings can run strong. So mindful that we ask people to be respectful of everyone. And if things should veer from that, I would invite the stakeholder co-chairs and myself to interrupt politely, diplomatically, but to stop the action and to get us back on track. So again, we are recording, and I'm going to ask if, Aaron, you can scroll down to the second page of the agenda, and that this is where our agreements are, and that is the second page, thank you. It's been there for years. These are agreements that were constructed by stakeholders years ago and were, again, in more recent years, but again, several years ago, were sort of updated. And I'm not going to go through every one of them, but let me just take the first one. We want to work together. We're going to stay solution focused, which you can imply means we're not getting personal about any other stakeholder, regardless of whether you agree with them or not, or the department for that matter. I will be calling timeout on any times when people seem to veer away from that. Thank you, Aaron. If we can move back to the first page. Now I'm going to see if there's anyone who is on the phone only who wants to identify themselves by pressing *6 and giving me your name so we can record you for attendance. Again, people who are on the phone only.
John?
Tracy and Ron Heller.
Okay, I hear Ron and Tracy Heller. Thank you.
John? John?
I'm here.
This is Cheryl Hargett-Dorset returning back to the group.
Welcome back. Hi, Cheryl.
Hi.
Okay, Ron, Tracy, Cheryl, anyone else?
Renee Farmer.
Renee, thank you. Anyone else who's on the phone only? Or if you're struggling with the online attendance link, certainly you can give your name now.
Jerry Froney, I couldn't get on they wouldn't accept me on the attendance gadget.
Okay, Jerry, thank you. I have your name. Sorry about that. Anyone else?
Danny Manzanares.
Annie, thank you. Anyone else who's on the phone only or cannot get the link to work for them? Okay. Hearing none. I do want to say to the group at this point that I do apologize for last week having failed to get the meeting reminder out last week, as I usually do the week before. I usually send it on the same day that I put things in the mail, or the what we call the snail mail group, and I apologize for that. It went out this morning. I do want to say, by the way, if you, for any reason, cannot access documents online, you certainly can always to be added to our what we call our snail mail group. Things go out through the U.S. mail. And years ago, we seemed to have some problems with that, but things are seeming to have gotten better. So I'm glad that things seem to be getting to people in a timely way through the mail. Okay, I will move us forward to the open forum. And I said a minute ago, just a reminder about what the open forum is and is not. So ask for names. You can type your name in the chat. You can raise your hand in the webinar, which, by the way, is a two-step process. If you're online, you go down to the reactions button on the bottom, click that, and it will open up a little menu, and you click raise hand. It's different from Google Meet, which is a one-step process, but, and again, if you want to lower your hand, if you change your mind, you go there again and click that. So anyone for the open forum number 1? Unmuting your phone by pressing *6 to give me your name. Type your name in the chat or raising your hand in the webinar. Let me see if I see any names. Currently, I don't see any hands raised in the webinar. I don't see anyone typing their name in the chat for the open forum. And I'm not, oh, I beg your pardon. There's 2 people. Okay. I was, sorry, folks. I was thinking it was Google and I was looking for it in a different place. Okay. We have 2 people. As always, I will start with the non-department, non-staff folks. Kelly Tobin, please go ahead.
Hi there. Last meeting, I had mentioned, or I had asked a question about the payment in 15-minute segments. That I had stated that it seems with PPL at least, that aides or attendants have to work 8 minutes of a 15-minute period to get paid for any of the time. And then if they work 7 minutes or under, that time is dismissed. And David, sorry, I've forgotten your last name. David had spoken up and said that he understands that as illegal. And that's also how I understand it. I mean, worked time is work time. So I would love to hear either an explanation of how that came about, or I would like to get that on the agenda so that we can address that issue, because I mean, I'm just not all right with my aides not being paid if they go pick up a grocery order and it takes 7 minutes. I'm not all right with they're not being paid. So anyway, thank you.
Okay, Kelly, I will say that having said what I did a minute ago, we will not get into this as a topic right here and now, but
Oh, thanks.
I am noting that you've made this agenda request, and we have our prep meeting with the co-chairs every month to go over requests, and this will absolutely be figured out as to when this goes on the agenda for this meeting.
Thanks for the reminder again, John. Sorry.
No, that's no problem. It's great because this meeting's been going for so long. It's good to, say these things over again because some people are new. So thank you and welcome back to our meetings. You were here last month, but
Yeah, doing better, a little better these days. It was in a really rough spot for a while. So good to be back and get my brain back in gear.
Right. Thank you. Okay, so seeing no other advocates, family members, recipients, etc., I will move to staff and Erin Thatcher.
Hi, everybody. This is Erin Thatcher. Apologies, I have a crazy storm coming through the mountains here, so I hope I don't drop, but I wanted to share updates about the July 1st rate increase for CDASS. There is a rate increase for most home and community-based services. That information should be coming out soon for non-CDASS providers. But we will be increasing rates effective July 1st. And there's some additional funding for people in the Denver area who have a high minimum wage, which is $17.29, to make sure that all those Denver folks can be paid. And then the state base wage will be going up to $15.75 per hour. So the rate increase, there's like a bunch of different ones. I'll try to put information in the chat and then we will be sending these out also. But to go over it really quickly, our health maintenance rate for our EBD waiver, CMHS waiver, brain injury, and then community integrative health waivers. The health maintenance rate will go up to $9.02 for every 15 minutes. And then we've got an increase a little bit more than that for Denver to $9.18. And apologies, that includes the SLS waiver. So health maintenance is going to $9.02 outside of Denver and $9.18 inside of Denver. There is associated with this an increase to the max rate. So currently the max rate for attendance is $51.43 per hour. Effective July 1st, this will go up to $55.08 per hour. So with that being said, this rate increase is very exciting for us here at the department because we are working on a plan to automate our rate changes for case managers. So there's a lot going on behind the scenes to make things easier for them. And more information is being provided to case managers. So, at a high level, rates will be changing July 1st. And if you are a member on CDASS, you will get a notification from your case manager about your new monthly rate by the end of June. So yes, we will provide these in the handout. We've just been working on finalizing that. But thank you, everybody.
Okay, thank you, Erin. Erin, you will be sending, you did mention at the beginning, you'll be sending the information out, sounds like.
Yes, John, we've got a little handout that we can provide. Thank you.
Yeah. Okay, thank you. We see Julie's hand raised. Julie, we're trying in these open forums not to get into a back and forth, and I don't know, I did see the question in the chat. So I'm hoping that did address it.
No, it was actually another question, but I'll just chat it to Erin.
Okay, thank you. We are moving forward. No other hands raised. To Community First Choice Update, CFC, and I believe we have Christine with us today. Christine Dos Santos.
Hi, thank you, John. This is Christine Dos Santos with the department. I'm just going to give a quick update in regards to our last CDASS CFC work group meeting. We did meet on the 17th of May, and our topic for discussion at that time was kids utilizing CDASS. So under CFC, children will have access to CDASS, and so the group wanted to discuss if there's any possible policy changes or adjustments that we need to kind of keep in mind when we're looking at CDASS as it'll work for our pediatric population. And we did get some great feedback. Some of the feedback we received was in regards to supervision of children, and that we need to ensure that we're doing in-person, in-home visits. There have been some changes in regards to requirements of in-home visits, and that we are going to allow for some virtual visits instead of in-person. That continues with our case management visits, but the stakeholders did kind of note that we really do need to have some eyes on. So that is something we'll be taking a look at. Other feedback included considering stricter requirements related to sex offenses, ensuring that case managers are aware of any child protection agency involvement. Also suggestions around AR requirements that may need to be changed or adjusted to allow for some creative solutions in identifying potential ARs for children who have a parent, caregiver, or attendant. There was suggestions in regards to developing educational materials for families considering using either of the participant-directed models, but making sure that families know the differences and the nuances of our two programs, so that they can make educated choices for their family. And then lastly, all training materials for members, ARs, and case managers need to be reviewed and updated to include some child-specific information. And that is it. Does anyone have any questions, concerns, comments?
If you do, folks, we're going to use the speaker's queue right now. So if you can raise your hand in the webinar or type your name in the chat, for example, John for the queue, letter Q. Or if you're on the phone only, you can press *6, unmute your phone. And again, the reactions button on the bottom, to click that to then be able to raise your hand. Anyone? Comments, questions? Or Christine? Okay, Christine, I'm not seeing anything, hearing anything.
Okay, great. Thank you so much. And just a
right.
reminder, I just wanted to throw it out here. I forgot to say, our next CFC Council meeting is going to be on, and I believe it's June 7th, and that is from 10 to 11:30. And that engagement is on the OCL stakeholder engagement calendar, where you can find the link to the Google Meet. Thanks again.
Thank you, Christine. This is John again. Before we move on real quick, I just wanted to mention we have a part of this which is not on the agenda, which is okay, but we do have an attendance and voters document, which has been managed by stakeholder Robin Stevens for the past several months now, and she's doing a great job with it. And as we need to refer to that document, if and when there is a vote, I should say when there is a vote in this meeting, there certainly will be more stakeholder votes. We can certainly pull that up and go over it. If you have any questions about your voting status, that is a question for other stakeholders. The voting rights is a stakeholder function, and it is determined by stakeholders. So you can certainly email me and say, I have a question about that. Maybe your attendance record is not accurate, and so on. I can forward those questions to Robin. So just to mention that. Okay, we are now moving to item number 6 on the agenda. An update around authorized representative payments. And there's an asterisk there. I'm not sure what that is, but Robin Bolduc, are you with us?
Yeah, I'm here. Yeah, I'm not sure what it is either. We have not met. I think there was a small group of us that was going to meet. We have not met. I've been ill myself. and still dealing with the loss of hearing. So I'm reading the captioning, which helps. The only thing I was thinking of, it actually becomes, no, I'm sorry, I'm just not doing well at the moment. We're going to have to meet. It was looking at payment of authorized rep. CMS said it can't be done. So we're looking at whether or not creating support brokers could fill in some of that need and take some of the responsibilities away from the authorized rep. There's an issue of it's difficult, and as we expand CDASS, it's going to become even more complicated to find authorized reps, especially it will be all the minor children. So hopefully I will follow up on that with the group. If someone wants to spearhead that besides me, that would be wonderful. Thank you.
Okay, thank you, Robin. I do see a hand up. I assume it's related to this topic. And before I get to Kurt, again, folks, if you have a question or comment for Robin, or for, yes, Robin on this, you can raise your hand, type your name in the chat. And if you're on the phone right now and want to respond, you can unmute your phone, press *6 right now. Give me your name. Okay, hearing none. Kurt, please go ahead.
Sure, thanks. Robin and I did talk a little bit about this, and I know Nathan, I don't know if Nathan, if he's on the call or not, has brought this up before. Take a little bit different path with the idea of a support broker. The idea would be that this would be a paid person out of your allocation, and basically whatever there's a stipulation of how much that would be or something like that, that would be a way kind of around the whole CMS issue. So the whole idea is, I don't know what that qualification of that support broker would be, but I really like that idea, at least as someone, especially as things are going to get harder, getting someone to be an authorized rep or people who need them, whether it's Alzheimer's people or kids, is something we need to address. And I think if we can move forward with that, this wall committee, Robin and I will kind of spearhead it, but I'd sure like it if we could get some input for some other people. All right. So that's kind of the topic, is that it would be not a government run one per se, but a person who's certified to be an authorized rep in a paid type position. Right, Robin?
Yeah, in some states, there's independent support brokers, they're contractors, and they're required to take a course, training. So it could be something like Consumer Direct could do a training for independent support brokers, which is a little different than I think where the state is going, which is for the training entity to take on some of the support broker responsibilities. I think we could do both personally, but why don't we get together and come up with a formal position on it?
Yeah. Anyone else out there? Any comments from anyone else?
I agree with a meeting to get on the same page and make that formalized and a direct approach.
Who was that? Was just speaking?
That's Nathan. This is Nathan.
Nathan.
Kurt, if you could spearhead that and organize it, that would be great. I'm still really adjusting to closed captioning and all that kind of stuff. Thank you.
Robert, I'll do that. We'll be in touch, and I'll start moving forward with that. All right.
Thanks.
All right. I think that's it, John. Whatever you got next.
Okay, thank you, Kurt, and thanks everybody. I would just draw your attention, Kurt and Robin, there looks like a question in the chat from Ashley, but perhaps that goes to the conversation that needs to happen later on in time regarding this. Seems to me, could be wrong. Item number 7, sick leave use after member's death. The asterisk, which I should have remembered, just simply designates a stakeholder requested topic. It's right there on the agenda. So Julie Riskin, please go ahead.
Yes, I raised this, I believe, in open forum last time. I just wanted to see if the group was interested in supporting a motion to do a policy request to the department to say that people should be able to get their sick time paid out if the member dies. What the rule says is that if they leave employment, they don't get their sick time paid out, which is standard in most jobs if it's just sick time and not PTO, I think. But when the member dies, the worker is not leaving their job. The client left them. I mean, obviously not deliberately. And it seems very cruel to not pay that, particularly, for family members, but also even non-family member aides generally get very close to their clients, and they should at least get that little bit of respite. So I'm asking for a vote on this, that we will make that request. That what we were told by the FMS is that HCPF doesn't allow that. So I will make that motion. Is there a second? Or I guess I shouldn't ask that. I should let Kurt or Kevin ask that.
That's okay, Julie. I know you're just gonna, I was just gonna say, as Julie's making that as a formal motion, do we have a second out there?
Absolutely.
From anyone who would like?
Yes,
Okay,
Nathan.
so we got it. So for the record, we have Julie making the motion and Nathan making a second regarding moving forward with the proposal for sick time after a member has died. Kevin, between you and I, will get that proposal written up and we'll get that to the department moving forward. And Julie, I'll forward it to you as well, or if you could send me any specific information how you want it worded, that would certainly help.
I was just going to ask that too.
We have a first and second. Is anyone against us supporting a proposal to go to the HCPF regarding this? So with that being said, no one being opposed to it. So we'll move forward with this and it's approved. Okay. All right, we're good there. What else do we have? John, we got unemployment next.
Yes, Kurt, that is correct. I think if I may just make a process point, I think having something written up would be good to run it by the group in the next meeting just to make sure everyone's okay with the wording of it, because this was sort of verbal, but I get the intent.
Most
okay,
definitely
item number
we'll
8.
get it written up and present it.
Yep.
All right.
Okay. So item number 8 on the agenda is unemployment for CDASS family caregivers. And again, topic requested by stakeholder. I believe Robin Bolduc again on this one. Robin?
This was actually, I think it was Julie, me, and Sandy, and again, because of complications, we did not meet. The issue being is that in the state of Colorado, it's not a CDASS or Medicaid issue. In the state of Colorado, spouses cannot be paid unemployment, and we don't pay into it because we can't be paid unemployment. And again, as we expand CDASS into children, what I've seen, I mean, I'm a spouse who's employed by my husband, but I think what's more common is that one spouse is the AR and the other spouse is a family caregiver. So when our spouse or child goes into the hospital, sometimes for extended periods of time, we are unemployed. And we can't collect unemployment. So other attendants can collect unemployment. As a spouse or a minor child caregiver, we cannot collect unemployment. And again, that has to do with the state of Colorado and labor laws in Colorado. So my thought is perhaps we can get an exemption for consumer-directed programs for that spouse issue, since that certainly wasn't intended when that rule was made probably 50 years ago. I'm not sure the interplay with difficulty of care payments for those of us who are live-in, and Sandy was going to look at that, and I don't know if she's here or not.
Sandy Kasperzak, is that who you refer to?
Correct, from PPL.
Okay, let me see if I see her on the list.
Sandy's not here today.
no.
She's going to be in later, but she's not here right now.
Okay, thank you, Ashley. Folks, let me just say that if anyone has any comment, I know we have 2 hands up so far. We're going to get to you. Anyone else at this point for a response, question, comment regarding this topic that Robin has begun for the meeting? You can, like Kurt and Julie, raise your hand in the webinar. You can type your name in the chat. Or if you're on the phone only, you can unmute right now to give me your name. Okay. Seeing none others for the moment, let's start with Kurt and then we'll go to Julie.
Okay, I did do a little research on this, and there's requests of a few people, but also as a peer trainer for the program, and I'm sure Adam and Katie Spade can attest to this. This is an IRS rule. It's under publication 15, which is a huge bunch of stuff to read, but basically this is not a state requirement. It is a federal requirement by the IRS, the way I understand it now. I don't know if that's optional to not pay in or mandatory, but right now when we teach it, it is an exemption for spouses for both state and federal. Spouse working for a spouse. So from what I understand and from what I read so far, that's an IRS rule regarding exemption for taxes. The good news is more money you can pay the person as they go. The bad news is if you get laid off, you don't get unemployment. So that's what I've read so far. Have you heard anything different?
No, it is a state rule. I applied for unemployment when Bruce was in the hospital, and they gave me the state rule. I don't have it. It is a state rule. Many states have it. So it may also be an IRS rule. I don't know. So we may both be right.
Okay. I'm just going by what I see in our training manual. I did look up publication 15. There's a lot of reading in that regarding taxes, which I am by far not a tax expert by any means. But I did sleep at a Holiday Inn one time, so I'm pretty smart. Okay. Julie, what did you find out?
Well, I just wanted to add that, I mean, the spouse issue and the parent issue was important, but I just ran into this with a parent of an adult, like someone like the person was like 40 when he died, and the mother was told, because it was a difficulty of care, it was a live-in, was told, well, you didn't pay into it, you can't get it. And another thing that's just very cruel, because after someone, in this case had cared for their adult child for 26 years, to say, well, now you've got to go find a job like this week, it seems very cruel. And I understand if you don't pay into it, you can't get it, but I'd like to have something at least where it's allowed. Again, I think maybe we can have the Department of Labor come talk to us about what the rule actually is, since none of us are labor experts. But I think we should say if someone wants to pay into unemployment, they should be allowed to, even if they don't have to. I think with taxes, that might be a different thing. I think this whole difficulty of care thing might be more trouble than it's worth, but I understand that that's not something we can control on the state level. But I'd like to see if we can at least offer it. And then again, people can make a choice. Some people might choose to have more in their pocket, but it just seems to me very cruel to ask someone who has lost their loved one and they're grieving and they've then lost their job to then have to go find a new job. For most people, it's within a week. And that just, again, seems unspeakably cruel. And I've seen it happen numerous times.
Yeah, and to make it even more complicated with difficulty of care, we're not paying into Social Security. So we don't have a Social Security benefit. unless
Right.
we've worked another job in the past. So it's the difficulty of care, live-in, spouse issue is really complicated. And maybe what we need to do is look outside and create some sort of pool or program or something for folks, so at least they would get, 30 days of income. And maybe it needs to be totally outside the formal process of unemployment and Social Security.
Or advise people to get a second address, so they're not technically living there. Because I mean, again, I've seen this happen repeatedly, and it just happened to someone else I know. And it's hard enough to deal with the loss of a loved one without having to like figure out your income so fast.
Julie, when I was reading the rule here, they do pay into state unemployment if it's an adult, if it's a parent taking care of an adult child.
Yes,
So
and
should
they
have
had
gotten
not.
state unemployment.
Well, the
They should have got
FMS had
state.
not paid into the state unemployment.
Oh, that's a whole nother issue then.
Yeah,
So-
they
so-
should have, but in the case
If-
of a spouse, they can't.
So,
this-
That's correct.
so then that's maybe a second issue. If that should have happened and they didn't, then does the FMS then need to give the person some money or something? Because this person was told very clearly no one had paid in for them. And I didn't know that I thought that if you were a family caregiver, that no one, that difficulty of care thing, that you weren't paying anything at all. So it looks like Julie Lawson may be able to enlighten us.
Hi. I just wanted to let you know that the difficulty of care is a totally different situation than what you're talking about with the unemployment and the Social Security. Changing an address wouldn't change whether you were exempt from those or not, because these two items, the unemployment tax and the Social Security, are about your relationship with the employer. The difficulty of care is about federal and state income tax. But the Social Security and the unemployment are just about your relationship to the person who's employing you.
Well, so Julie, can I ask her a question about that? So
Yeah, go for it, Julie.
And
Go
so
ahead,
in
Julie.
this case, I was the AR. I have no familial relationship to either the client or the caregiver. So if I'm the AR, isn't the worker's relationship with me?
Are you the EOR? Do you hold the EIN on the account?
No.
Okay, so it's
the
with
FM
whoever holds the EIN.
Okay, but even if I was the official AR.
Yeah, if you held the EIN as the AR, if you held the EIN, then the relationship would be with you and not with the member. But it's whoever
Okay.
holds the EIN.
So they wouldn't pay unemployment?
So when you fill out that form, it asks you who you're related to, and then it checks it
Right.
off. And it
Yeah.
really says on there that in Colorado, you can't be exempt from the state unemployment tax. So I suppose I'd have to have specifics to look into that if
Yeah.
somebody saw something different there, but that's what the form
It
says.
wasn't with the FMS you work for, but so okay, so then maybe a question for HICPUF is, what you're saying is that at PPL, someone can be difficulty of care, family, whatever, and you guys are still going to take unemployment out and pay it
For state.
for state. Yeah, state.
Yeah, the state unemployment we would still take, but the you could be exempt from the federal unemployment and
But
from
if
FICA.
if you only pay state unemployment, you should still be able to get a benefit though, right?
I honestly don't know. It would certainly seem like it. It would seem like there
Right.
is both federal unemployment and state unemployment. So it would be, you should be entitled to something at the state end, but I don't honestly have that as a fact.
Right, and that might be beyond what we're talking here. And that's what the state has to do on employment issues. And keep in mind, if you work for any other employer in the previous, when you apply for unemployment, it looks at your current employer, and it also looks at possible unemployment from a past employer. So it's just a matter now, if they work forever for that same person, it's going to be a percentage based on that. Again, that's someone we maybe need to talk to in the Department of Labor, I think, Julie.
Yeah.
Find out what's going on there. I think it's something we should move forward with and make sure that it's being done correctly. Maybe that's something we want to follow up with and include in our prep call to see if we can get someone from the Department of Labor to talk to that effect. Okay, Aaron and John?
Kurt, this is John. I believe Aaron stepped away for a minute, so we can certainly talk about that in our
Okay.
monthly prep call, absolutely.
If you can make a note of that, I'd appreciate it.
Sure, and the note I'm writing down, there's a number of things, so pardon me. Unemployment issue, I'll just make that note. Good enough?
Yeah, say, put Department of Labor question.
Department of Labor, got it.
All right.
Got it. Okay. Let's see. I will ask Robin, I guess, but I'll ask everybody who's been involved in this. Is this for the moment where this conversation stops for the moment for item number 8?
I think the Department of Labor coming in is our next step.
Okay.
Agree. We need clarification on what's a Colorado rule, what the IRS has to do with difficulty of care. So I think we need the Department of Labor here to clarify at least that piece of it. What's a Colorado rule?
Okay.
And I'll
Very
look
good.
back at my notes from when I was denied unemployment and see if I can find something.
Okay, thank you, Robin. So I will address my comments right now to the co-chairs and the other staff who are on the call. We have a little bit of a time issue. It's a pleasant dilemma to have, but it's 1:45 now. We have our break scheduled for 2 o'clock and the breakout rooms for 2:10. Now, there are a number of people who call into these meetings, they log in, call in, whatever, in time for the breakout rooms. So we don't want to change the time of that too much. It's just not fair to people, especially for group number 1, members, families, advocates. So I'm trying to figure out how we can make use of this time. Let me ask this, and I think it's the co-chairs and all, the expanding CDASS report out. Is that something that we can cover right now? Does it require waiting until after the breakout rooms, or could that be talked about? Kurt or Kevin?
I think I'm pretty prepared to talk about it. We really haven't. Kevin, are you there?
Yeah, I'm here.
I haven't really talked to Kevin about it. I talked to Robin and a few other people. We really haven't laid anything out regarding expanding CDASS. This is something I think we have to ongoing discuss regarding whether it's leftover funds, how we use it for future funds, whether it's for transportation, other things. I did some research on it, for example. And Robin had mentioned in other states, they do some things like transportation, maybe it's ramps on things like that, and maybe it goes into a pool. But I think we really need to get together as a group and say what, and ask what and find out what we're asking for. So I really don't have anything else other than that. Robin and Kevin, if you have anything, please feel free to chime in, but I think that's really what we're looking at there, okay?
So
Did you see
Kurt, are
Julie's
you,
hand raised? Oh, go ahead, Kevin, sorry. Go ahead.
I was just gonna say, Kurt, are you suggesting a small group to discuss this, or how do we move forward?
Yeah, I think with the help of Robin, and Robin's got a lot on her plate. I'd like it for some, I see Julie has her hand up, Oliver has their hand up. Maybe we can form a group and say, what are we looking for? So, with that said, John, maybe you could take over regarding who had their hand up first.
I believe Julie, and then we'll get to Oliver. Julie, go ahead.
Yeah, I think the other thing is that, there are other HCBS services that could do really well with a consumer direction model. Home modification, I was just talking to someone today where there's only one provider in her county, and the guy was like kind of creepy and abusive with her, and she's a single woman and doesn't want him in her house. But there's no one else in 9 counties. But she knows lots of contractors who could do it. All of the services for the complementary and integrative health that, like massage, acupuncture, that used to be called the spinal cord injury waiver, those would all be good for consumer direction. Transportation, where people could just get a voucher for $1 amount and then not have to be stuck with one provider, but they could, like, almost like a card, like use it however they wanted and stick within their budget. I think there's some day stuff that might be better done consumer directed. So really the goal of consumer direction should really be thinking of this as a model and having this be for all, or at least most services. I think respite is another thing that could be better provided consumer directed, because right now it doesn't really, like, it's okay for CDASS because we can just kind of pile it on if you have a big enough allocation, but for other people, it doesn't really work. It's kind of being in a nursing home or nothing, because they only do it with personal care. And if someone has needs beyond that, it's just a mess. So I'd like to see the model expand to other HCBS services, because the model works better. So, and of course it would still always be a choice. So if someone didn't want to self-direct, they would never have to.
All right, thank you, Julie. Go ahead, Kurt.
I would say that's outstanding. I think we got to get this in writing and somehow formalize it and present it to the right people. So I'll just back off, and I see Oliver still has his hand up.
Yeah, great.
Oliver, please go ahead.
Thank you, Kurt. Thank you, John. I just want to echo Julie's statements. And I would be willing to work on a team with whoever is willing. I'd love to help get that wording together and work on a team with anybody.
Thanks for that offer, Oliver. I'll just say that on behalf of the whole group and would remind everyone this is really a stakeholder event, this whole thing. Departments here, obviously, it's a collaborative, but really does take stakeholders, so thanks. I'm going to go over quickly to Jessica, who may have an update for us.
Hi, everyone. Jessica here. I don't really have an update. We're going to stick to the schedule for NCAPS updates, which are quarterly. So the next one will be in July, but I'll just share that things are going well. We're looking at closing out the project in September. And so more detailed information to come. Thanks.
Thanks, Jessica. And I just want to respond to something that Julie had put in the chat. I think it's a great idea, actually. I think that as you may have picked up, folks, through my comments today, really trying to keep the breakout rooms more or less at the same time. I think that if we can have a disclaimer on the agenda that says, if you're interested in a certain item, please know that depending on how the meeting goes, maybe plus or minus 15 minutes or something like that. I'm going to bring this up with again, in our prep meeting that we have with the stakeholder co-chairs, which happens monthly, to talk about how the meetings are going, how we learn as we go and improve the meeting, which has happened a lot over the years. So thank you, Julie, for that. I would want us to minimize the amount of time we move that particular item around, but I think it's a great idea. So with that, let me look back at the agenda, and we do have the break scheduled for 2 o'clock. The breakout room scheduled for to 10. So I'm wondering, folks, if we can do both of those 10 minutes early, or actually 8 minutes now. We'll do the break now. Then we'll come back. My clock reads 1:53. We'll come back at 2:03 and do the breakout rooms. And if anyone feels that's not a good idea, please, would love to hear it. And we certainly want to consider every point of view. Kurt, Kevin, does that sound okay?
Good for me.
Okay. So folks, we will be back at 2:03.
Sounds good.
And we'll get into the breakout rooms. Thanks, Kevin. Thanks, Kurt. Okay, everyone. This is John Barry. I want to welcome everyone back to the May PDPPC. This is the Directed Programs Policy Collaborative. I notice we have what seems like more participants than we did in the first part. So I would remind people we do have an online attendance form, and it's somewhere in our chat, and I'll see if we can put it again in the chat. And also, I would ask if there's anyone now who's on the phone only, and you have not already given me your name for attendance. You can unmute your phone by pressing *6 and give me your name. If you're online, you can use the link. Okay, hearing none, I will move us to the breakout rooms, and I will turn it over to Jessica.
Hi, everyone. I'm opening the room. So as we do each PDPPC, you should see the option to either select breakout rooms at the bottom of your screen if you're logged on online. And that will give you the option to go into one of the 3 rooms. If you're having some trouble, just hold on a minute and you can work with John to get directed into a room. We can put you in one.
Okay, this is John Barry, and if anyone on the call, either in the webinar and you're having trouble with links or anything, or if you're on the phone, you can let me know if you need help to go into one of our breakout rooms.
Renee, members.
Okay, Renee, and can you remind me of the last 3 digits of your phone?
762.
Got it. Anyone else?
Gary Frowney, 0482 is the phone. And I'm on, I don't know why I never see an invitation to a breakout room. This happens for the last couple of months.
I don't know, Jerry, and I'll take a look at that. I will put you in right now, members only. Okay.
Thank you.
Anyone else like any help?
John, Danny Manzanares.
Okay, and which group, Danny?
IHSS, sir, please.
IHSS, yes. Okay. Anyone else?
Hi, John. Cheryl Brown. I clicked on, but I did not go anywhere. So the IHSS, please.
Okay.
Thank you.
Anyone else? Yes. Let's see. Ron Heller, are you with us? Are you wanting to get into a room? And it's, what are the 3 digits, last digits, sir, of your number?
Of my phone.
I'm sorry.
Of my phone, John.
The last 3 digits of your phone number.
846.
846?
No, 303 834 0640.
Got it. Thank you, Ron. Anyone else would like help? Hello, everyone. This is John Barry again. Welcome back from the breakout rooms. We had a little typo on our agenda. Apologies for that. We meant to have them initially end at 2:35, but we started a little early, so we were going to end a little early. But it ought to have been 2:35 to begin with. So we will now move to our subcommittees and work group report out. And we have covered, excuse me, we have covered the first two. And the third one, URUM, Utilization Review, Utilization Management, will be in July. So I believe the report out that we are due up for is IHSS, In-Home Support Services.
All right, I will take that one. Hi, everybody. My name is Emily Harvey. I am the policy advisor for the In-Home Support Services service delivery option here in Colorado. And we just had our breakout room, which is our subcommittee each month. So we went from quarterly to monthly on that meeting here, making sure that everybody has an opportunity to get those updates. And really the big hot topic this month is just that IHSS forms are being updated with plain language review, accessibility, as well as some translations. So forms will be translated to Spanish, Vietnamese, and Russian. And those will be finalized within the next month or so and uploaded to Consumer Direct for Colorado's website. So the IHSS resources are available right now as they are without those updates, and will be updated when they are released, making sure that we can get that out to people and that those are made available. The other thing were just a couple of questions about the previously discussed form, which was the Shared Responsibilities Plan form. And that's just letting folks know the general update that is completed by the agency and making sure that everybody has one in their file and that the case manager has a copy to make sure everyone's on the same page. So just a quick few updates and an exciting new initiative with those forms. And that is our IHSS subcommittee update. Thanks, everyone.
Thank you, Emily. And we have covered the other items already. So thank you. This moves us to open forum number 2. And if anyone has an item for the open forum, you can raise your hand in the webinar. You can type your name in the chat. Or if you're on the phone only, you can unmute your phone by pressing *6 and give me your name at this point. Let's see, I'm seeing none so far. I'm going to give it a minute or two and say that also, if anyone is on the phone only, has not given their name for attendance today, you can also do that if you like. Unmute your phone by pressing *6. I want to make sure we get all the attendance. Any names for open forum number 2? I am seeing no hands raised in the webinar, seeing no names in the chat. Okay, well, folks, with that, maybe an all-time record, I'm not sure. We're going to end today's meeting. Again, it has been recorded, and I will be sending that link out. I will commit to do that by the end of next week, but based on recent experience, it might be sooner as well. And obviously, I also placed the link on our PDPPC webpage. So thank you very much, and we will see you and or hear from you next month, fourth Wednesday in June. Thanks,
We have
everybody.
the second forum.
I am sorry, Jerry, go ahead, please.
I must have dozed off. Did we have a second forum?
Well, we had no one who had an item for the forum, Jerry. Do you?
Okay. All right. Thanks.
Oh, okay. All right. Okay.
Okay,
folks,
bye,
we
everyone.
will hear from you on the fourth Wednesday in June. Take care, everybody. Thank you.